Assalamu alaikum, brothers. In my half an hour target today, I have completed 3.76 kilometers and burned 468 kilocalories. So, running barefoot in the seesaw, right? It's very difficult. So, I have managed to do my regular exercise today too. Um, So we see this type 2 diabetes. We commonly dealing with the type 2 diabetes. So there are patients that comes with a lot of complications. So irreversible that we can't uh, make it back to normal. So the kidney disease are very common. So out of 100, like 40, they are not controlling the diabetic. Uh, 40% of the patient goes to kidney failure, kidney diseases. They need dialysis and they need kidney transplantation, which are very expensive surgeries and also a lot of suffering to the whole family. So to avoid this, right, in type 2 diabetes, so most of the people, they say that within 2 years we got it. Within 2 years we got it, the kidney diseases. Really, most of the time the kidney disease, this diabetes are asymptomatic. So they won't be able to find it at the beginning. So when you come to certain age or when you feel something different, you need, as a precautions, you do have to do the diabetic test, fasting blood sugar or HbA1c. How to test it? So that's it's very right secretly or without any symptoms, you can be a diabetic patient. So that is very important. So you have to check it, all right, when certain age around 30, 40, you have to regularly check it your creatine level, even creatine, because the pressure also affect the kidney. Patients with without knowing that they are hypertensive also goes to kidney failures. Right? Most of the kidney failures are due to diabetes, I think type 2. Even the type 1, 50% of the type 1 patient, type 1 diabetic patients are goes to failure. But mostly, all right, this type 2 is the very percentage wise among the population is high. So the type 2 diabetes are going to kidney failure. So to avoid this, all right, you have to check up regularly HbA1c. And first 10 years of your diabetes, you have to keep it in a very good control. That your HbA1c, that you have to, once in 3 months you have to check it, that should be below 7. All right, and then you can avoid. And also fasting blood sugar, you can, if your 3 months blood sugar, that HbA1c, if it is below 7, that your fasting blood sugar, it's very controlled, right? So this, these complications of diabetes, micro and macro vessels vasculitis. So macro vasculitis, that affects the brain and, right, heart and the legs also. But micro vessels, right, that affects the heart, even heart attack, and the kidneys and the neuropathy to the legs and the other organs. So to avoid all these complications, keep your blood sugar, all right, HbA1c within 7. So you will be able to make this, to achieve this, do a regular exercise and the life modification and regular follow-up. So you can, all right, keep your HbA1c within 7.